Hello, thank you very much indeed for inviting me to talk at this important seminar on the impact of climate change. I'd also like to thank the President, Jackie Taylor, for inviting me. So I'm going to talk about the impact on health and disease. And of course, climate change just affects everything. It affects our social and environmental determinants of health, clean air, safe drinking water, and sufficient food. But it's been predicted that between 2030 and 2050, there'll be 250,000 additional deaths per year. And this will be due to malnutrition, for lack of food production, malaria, long transmission seasons, and diarrheal diseases due to polluted water. And of course, extreme weather events that climate change will actually impact on health. And the extreme weather events are things like heat waves, storms and floods. Lives will be lost, millions will be disrupted. There'll be an impact on healthcare facilities. And of course, we've seen such related disasters in India, Pakistan and many other countries. And of course, with a rising sea level, we're going to be destroying homes and livelihoods. So the rising sea level, as the climate change increases the severity and frequency of rainfalls, and it's also been noted that after precipitation events such as a rainfall or snowfall, we'll see outbreaks of waterborne diseases, and thus there will be an increased burden from waterborne diseases. The other things that will impact are on air pollution, and this will be from burning fossil fuels, forest fires, waste burning, and harmful agricultural practices. And it's been again estimated that over 7 million premature deaths per year, and that's 13 deaths every minute, will occur. Changes in weather and climate will cause an increase in foodborne, waterborne, and vector-borne diseases. Food systems will be disrupted by extreme weather, leading to food insecurity, hunger and malnutrition. And then lastly, mental health, with the post-traumatic stress disorder, depression, anxiety, and also the worsening of existing conditions. So I'm going to talk about these four in a little bit more detail. So starting off with air pollution, and this is indeed driven by climate change. Greenhouse emissions are also sources of air pollution. 7 million deaths per year worldwide, and is thought to be the world's largest environmental health threat. It's estimated in the UK that there will be 40,000 excess deaths per year, and this was run by the Respiratory Society, saying that this will be due to air pollution, and this will be in terms of asthma, bronchitis and so on. And of course there will be a negative impact on air quality by things like transport and residential heating, with the use of biomass and biofuels. But you know, we can do something about that, because in 1979, that was about 40 years ago, 32 countries signed up to reduce air pollution, and certain air pollutants have been reduced by 40 to 80 per year, and about 600,000 premature deaths have been avoided. So it can be done. So going on to water and sanitation, and this is now the current situation, which indeed is dismal anyway. It's estimated 3.6% of the total disease-adjusted life years in global health burden of disease. 58% of this, and that's almost 850,000 deaths per year, are attributed to a lack of safe drinking water supply, sanitation and hygiene. And you remember the WASH, the WASH acronyms there. And sadly, 2.5 million human deaths occur annually, mainly due to diarrhea, vomiting, cramps, in fact, infectious diarrhea. But the tragedy here is that many of these deaths are in children less than 5 years old, who are dehydrated, malnourished, and sadly cannot survive. And of course, floods have got a lot to do with this, because you can see, looking at this picture, how easy it is for the clean water system that we all drink to be mingled with the rather dirty water outside, and you can see how sewage can seep into that water, and in low middle income countries that's of course all they will drink, and therefore they get ill. So the harmful contaminants in water which we use for drinking are more than just the biological contaminants of microorganisms such as bacteria, viruses, and protozoa. The things we forget about, they're chemical contaminants, both natural and man-made, and this could be bleach, from your pesticides, toxins, and so on, and industrial products, drugs, and things like that. And even, for example, if you use your washing machine, all the effluent there would actually go into the rivers and into the sea. And radiological contaminants, again, they're autonomically unstable chemical elements, and these emit harmful radiation. Physical contaminants from rocks or soil, usually harmless, and they're large particles. But the last one there, which I can't see on my screen, but I hope you can do, are microfilaments, which are not thought about. Now, of course, microfilaments less than 5 millimeters are what are really injurious to a lot of us. They've been swallowed by fish. We've seen them in whales and other bigger animals in the sea. But it's reckoned that about 8 million tons of microfilaments are put into the water. Now, we've seen problems in fish, but we haven't yet seen that in humans. So the different categories of water-related diseases. And if you look on the left-hand side here, waterborne diseases are obviously things that we ingest, and that gives us cholera, enteric fevers, typhoid, and so on. They can be water-washed, where transmission can be reduced by washing the whatever it is you're going to eat with more water, and that would reduce dysentery, amoebic dysentery, eye problems, and skin problems. They're also water-based, where the pathogen itself spends part of its life in the life cycle in the host, and this may well be water-based, such as guineaworm, worms, schistosomiasis, and then lastly insect vectors, such as mosquitoes, and they of course breed near water, and then obviously things like malaria, dengue, onchocerciasis, and trypanosomiasis will increase. And of course there are preventative strategies, most of them about drinking clean water with sanitation, obviously avoiding the infected water if you can do, controlling the vector, and for the mosquito and so on, perhaps with a bit of surface water management, try to destroy the breeding sites and the insecticides, and of course using mosquito nets is perhaps the best thing, I think, to reduce mosquito and malaria. So the question really is, why are viruses a great danger with climate change? And let me just take this example of dengue, which is, as you know, a flavivirus. Now that's transmitted mainly by Aedes aegypti, but there is another one, of course. But they feed by day, and they breed in still waters in urban areas. Now with the temperature rise, you get a shortened viral incubation, a shorter breeding cycle, therefore you have more numbers of virus, an increased frequency of mosquito feeding, and a more efficient transmission to humans. I mean, an amazing situation where you're now replicating, breeding faster, and getting more money for your buck, really, but buck for your money. But in fact, if only that could happen with the NHS, I'm sure we'd be out of a lot of problems. But by doing this, they of course increase more insects around. And of course, malaria, sadly, we still have 1 million deaths per year. 500 million are affected every year. And of course, most of the travellers who are infected, 25,000 or so, are because they haven't been taking their prophylactic. But there's been a huge increase in malaria with the higher temperatures. And the future tragedy may well be that we get malaria back again in the UK. And many of us have forgotten that it was actually endemic in marshy areas, particularly in southern England. But that may well be back. And this, of course, is cholera, which still, at the moment, has 1.3 to 4 million cases annually, with over 143,000 deaths per year. Torrential diarrhea, and here you can see the malaria beds with a hole there where you can put your bottom, and it just literally like a water tap goes into a bucket below. And the death obviously is caused by dehydration, and you fill them up with fluids. And we're hoping that there'll be a ending cholera global roadmap to 2030. So let's see where we get with that. So food systems, climate change again has implications for agriculture. This there'll be pressure on the land, whether that be because of drought and therefore you can't actually grow the stuff, or indeed it's waterlogged because of water. And because of that, there's going to be reduced productivity. And of course, fisheries, again, productivity is set to decrease by half worldwide. And this is both in stock productivity, but also with fish migrating patterns changing as it gets hotter. And I just wanted to show you this slide, which some of you might have seen before. It's really modeled on changes in cereal grain yields. But if you just look at it, the red and the brighter red areas are the areas that are hotter now, or are hotter now. But as time goes on with climate change, these are the same areas that are going to get hotter. And as you can see, they're mainly in the lower and middle income countries. So the low middle income countries are going to fare worse. And you can see with a lack of food production, you're going to get starvation, migration, and problems with a huge number of things, both economically and human problems as well. But on top of this, of course, you've got the flood, the storms, the fire damage. And you know there's been a fire going on in Siberia for years, one in California, Australia. Droughts, been one recently in Ethiopia. And of course, the climate-sensitive pests and infectious diseases are going to increase. And then mental health, many implications there. Mental health is always neglected, but what's going to happen is anxiety-related responses, as well as the chronic and severe mental health disorders, are going to increase. High temperatures, severe weather, good evidence that these events are linked to mental health issues. Flooding and prolonged droughts have been shown to elevate levels of anxiety, depression, and indeed the post-traumatic stress disorders. Again, trauma and losses from disaster leads on to homelessness, job loss. You lose your neighborhood, you lose your community, and therefore you've lost your sort of cycle of friends that you could perhaps talk to and perhaps negate your, or slightly negate the anxiety you might be suffering. And of course, we're now all getting equally anxious, and that's worrying about the environment. And this again is causing a lot of psychological distress in vulnerable people. So the impacts of climate change are really shown very, very well on here. So you've got increasing carbon dioxide levels, you've got rising sea levels, you've got more extreme weather and rising temperatures. And that leads out to the second circle there, where you've got air pollution, vector changes, and as you can see, all the things around. And then you can see, for example, if air pollution, you get asthma, cardiovascular disease, the vector, the sort of things I've been talking about, malaria, dengue, etc. Allergens, of course, respiratory allergens, again linked to the asthma there. Water, both will lead to diseases with cholera, etc., Campylobacter, leptospirosis, cryptosporidiosis. And then, of course, water and food supply will lead to malnourishment, diarrheal diseases. With the environment degradation, you're going to get forced migration, civil conflict, and you can just imagine what that could do. And then extreme heat, you've got heat-related illnesses and death and cardiovascular problems. And of course, with the severe weather, you get good injuries and fatalities and impacts. And these are just really to point out that really it covers the whole of medicine and a huge number of diseases. So in summary, climate change will have a huge impact. Diseases will increase with hotter climates, and there will be a significant impact on diseases, not just the old ones, but new ones, but also, for example, in communicable diseases, you may well get some of those coming back again, so you're getting recurrences of those. Life problems, massive immigrations, unrest, mental health, huge financial burdens, and if you just take it down to a family level, in low middle income countries, medical treatment, transport, special food, loss of manpower, 10% of the family income per person affected goes with that one person. And lastly, we really must do something to mitigate the effects, because climate change is going to have a major socio-economic impact. So thank you very much indeed for listening to me.